Proving that a baby product is clinically safe costs millions of dollars and years of controlled research. Printing #1 Pediatrician Recommended on the same product requires neither. A brand pays a private data firm to poll a few hundred doctors. The doctors check a box next to whichever brand name they recognize. The firm packages those answers into a statistic, and the statistic goes straight onto the packaging. Right now, that label sits on a toddler drink, facing class action litigation over its sugar content. It sits on a baby bottle, accused in federal court of leaching microplastics into warm formula. It sits on baby food from brands whose ingredients, according to a congressional investigation, contained arsenic at more than 90 times what the FDA allows in bottled water. These are not fringe products. They are the most trusted names in the baby aisle. And the system that put those words on the box, the polling pipeline, the legal framework, the institutional silence, was not designed to protect your baby. It was designed to protect the brand. You trusted that label for the same reason any reasonable parent would. The words "Pediatrician Recommended" carry an implicit promise, not just that doctors have heard of the product, but that they evaluated it, that somewhere a group of physicians reviewed the ingredients, compared the product against alternatives, and concluded this specific formula or bottle or puree was the safest choice for a developing baby. That assumption makes sense. Pediatricians complete years of specialized medical training. They see thousands of patients. They study infant nutrition, developmental biology, and toxicology. When they recommend something, parents listen, and they should. The brands buying these labels understand exactly how powerful that trust is. Surveys of physician networks show that 89% of patients trust their doctor's recommendation over internet research, and 94% of pediatricians report that parents actually purchase the specific baby product they suggest. When a label says a doctor recommends this one, the relief is immediate. You stop comparing. You stop worrying. Someone with medical training already did the work. I spent weeks tracing how this label actually gets onto packaging. The answer has nothing to do with clinical evaluation. Doctors aren't reviewing products. They're checking brand names on a paid survey. When a brand claims to be #1 Pediatrician Recommended, the natural assumption is that the claim emerged from clinical conferences, peer-reviewed literature, or professional consensus. The reality is more transactional. The engine behind nearly every major medical endorsement in the consumer health space is a service called the ProVoice Survey, operated by IQVIA, one of the largest healthcare data analytics firms in the world. IQVIA's own materials describe ProVoice as a #1 claims validation tool designed to help brands prove top-tier advertising claims like #1 doctor recommended. The service exists to validate a marketing position, not to discover whether the claim is medically warranted. A brand contracts IQVIA or a similar firm. The firm surveys a targeted panel of physicians, often just a few hundred. The doctors select brand names from a list. Many are paid through physician survey platforms like Sermo, which disperse $20 million to its network of over 1.3 million healthcare professionals in a single year. The doctors aren't reviewing toxicology reports or comparing clinical trial results. They're checking boxes next to names they recognize from marketing, free samples, and sales representatives. This practice has been documented for decades. In 1998, the FTC challenged Dell Pharmaceuticals for claiming 9 out of 10 pediatricians recommend baby Orahel. The substantiating survey hadn't asked whether doctors recommended the product. It recorded only that they were somewhat likely to mention it if asked. The FTC issued a consent order. The framework that made the claim possible survived intact. Nearly 3 decades later, the same architecture is still operating. True Height, a children's growth supplement, reached Target shelves nationwide in 2026, marketing itself as the #1 pediatrician recommended brand for children's growth. That national endorsement came from a survey of 250 pediatricians, out of roughly 60 to 90,000 practicing in the United States. While that label sat on shelves, the Federal Trade Commission filed an enforcement action against the company for deceptive advertising and entirely unsubstantiated growth claims. Internal data allegedly showed that children in the control group, the group taking nothing, grew slightly more than those taking the supplement. The product didn't work. The label remained legally viable. The label doesn't measure what works. It measures what doctors remember hearing about. If the label merely inflated a mediocre product's reputation, it would be a marketing problem. What makes it a health problem is what the label is currently shielding. Start with sugar. The American Heart Association and the American Academy of Pediatrics are unequivocal. Children under 2 should consume 0 added sugars. Early exposure trains the developing palate toward hypersweetness, drives insulin resistance, and sets a metabolic trajectory that persists into adulthood. Abbott Laboratories' Pediasure Grow and Gain carries #1 Pediatrician Recommended brand on its packaging. It is currently the subject of class action litigation, alleging the formulation is heavy with added sugars, and that Abbott suppressed internal clinical studies showing the product failed to increase children's height. Instead, children simply gained excess weight. The zero sugar guideline comes from the same pediatric institution whose authority the label borrows. The product contradicts the guideline. The label stays. Now consider the bottles. Dr. Brown's markets itself as the #1 Pediatrician Recommended baby bottle in the U.S. It is defending a class action lawsuit alleging its polypropylene bottles release millions of microplastic and nanoplastic particles into infant formula when heated, the standard preparation protocol for most families. Toxicological research links these particles to endocrine disruption, oxidative stress, and long-term damage to developing reproductive tissues and organ systems. Then there are the legacy baby food brands, Gerber, Beechnut, Earth's Best, names that carry the implicit weight of a medical endorsement built over decades. A congressional investigation and subsequent state attorney general inquiries found detectable heavy metals in up to 95% of tested baby food products from major manufacturers. Beechnut ingredients tested at up to 913 parts per billion for arsenic. The FDA limit for arsenic in bottled water is 10. An infant's body absorbs ingested lead at roughly 5 times the rate of an adult's because the same calcium transport system that builds bones cannot distinguish calcium from lead. These metals cross the blood-brain barrier. They accumulate in developing neural tissue. The damage is irreversible. The survey that produced the label never asked what was in the product. That's what these products contain. The question is why the system allows a purchased polling statistic to sit on the same package as documented contaminants. And the answer requires understanding a legal distinction that most parents have never encountered. Under federal law, there is a sharp boundary between 2 types of marketing claims. On one side are health claims, statements asserting that a product prevents, treats, or reduces the risk of disease. Those require pre-market review and what the FDA calls significant scientific agreement. On the other side are endorsement claims, statements about what professionals recommend. Those are governed by the FTC's endorsement guides, which require only a statistically representative survey showing that a substantial percentage of doctors recommend the product in their ordinary practice. The distinction determines the burden of proof. To legally claim clinically proven, a company needs peer-reviewed, double-blind, randomized controlled trials, research that costs millions and takes years. To legally claim Pediatrician Recommended, a company needs a receipt from a data broker showing the poll was conducted. No clinical proof required. No demonstration that the product is safer than alternatives. No evidence that the product works at all. When these claims are challenged by competitors, by consumer groups, by the National Advertising Division, the scrutiny lands entirely on the survey's math, never on the product's safety. When Abbott Nutrition's Similac was challenged before the NAD for claiming #1 Pediatrician Recommended brand, the investigation focused on whether Abbott had improperly combined polling data from different product lines to inflate their numbers. Whether the formula itself was the safest option for infants was never on the table. It was never meant to be. Some companies have taken this logic further. Registering Pediatrician Recommended as a trademark, intellectual property permanently affixed to packaging, regardless of whether the underlying survey is ever repeated or the science ever changes. This is where the international comparison becomes unavoidable. Under European Union Commission Delegated Regulation 2016/127, the use of claims like recommended by doctors on infant formula is explicitly prohibited. The European Commission treats medical endorsements on baby products as an inherent threat to public health, a form of marketing that distorts parental decision-making and undermines clinical independence. The same formula that carries a medical endorsement on an American shelf would face regulatory action in the European Union, not because the product is different, because the law is. If the regulatory framework permits the label and the polling firms generate the data, there remains one final assumption, that the medical profession itself, the pediatricians, the AAP, the hospitals, would push back if the system were truly this compromised. They haven't. The financial architecture explains why. The American Academy of Pediatrics, the single most influential pediatric organization in the world, has historically received approximately $3.3 million annually from infant formula manufacturers. Companies like Abbott and Mead Johnson hold top-tier sponsorship at the AAP's annual conferences. An organization financially sustained by formula manufacturers is not structurally positioned to mount sustained public campaigns against the marketing practices of those same corporations, not because anyone is individually corrupt, but because the incentive structure makes confrontation irrational. This compromise extends into the hospital itself. For decades, formula companies provided free discharge bags to maternity wards, branded packages of formula samples handed to new mothers by nurses in the hours after birth. Research published in Pediatrics found that roughly 67% of women who initiated breastfeeding received these commercial packs, and that receiving them significantly reduced the duration of exclusive breastfeeding. The mother perceived the bag as a clinical endorsement. The brand later surveyed the hospitals and counted that distribution as a recommendation. And here is where a structural blind spot in federal law seals the system shut. The Physician Payments Sunshine Act was created to expose financial relationships between doctors and the companies whose products they prescribe. But infant formula, toddler milks, and conventional baby foods don't meet the statutory definition. They aren't prescription drugs. They don't require pre-market approval. So the free samples, the sponsored conferences, the consulting arrangements, none of it appears in the public database. State-level transparency laws often carve out explicit exemptions for infant formula and medical foods. The system built to expose influence in medicine was written with an exemption for the products your baby consumes every day. If this argument can't survive the industry's strongest defense, it doesn't hold. So here it is. The industry's most credible position is this: pediatricians are educated professionals with real clinical experience. When they recommend a product, they're drawing on years of patient observation. The surveys capture that experience in statistical form, providing a useful signal for overwhelmed parents. And infant formula specifically is one of the most tightly regulated food products in the country, a genuine, life-saving necessity for millions of babies who cannot breastfeed. That defense is partially valid, and the critique here is not aimed at it. Infant formula saves lives. The scientific achievement of modern formula is real and should not be undermined. Individual pediatricians are not villains in this system. Most have no idea that their aggregate brand recall is being harvested by data brokers and turned into retail packaging. They are, in many ways, as captured by this system as the parents they serve. But the defense falls apart the moment the label moves beyond tightly regulated Stage 1 infant formula. Pediatrician Recommended is not restricted to life-saving products. It appears on sugary toddler drinks that contradict published pediatric guidelines. It appears on polypropylene bottles facing microplastic litigation. It appears on growth supplements whose own trial data showed they didn't work. The existence of a medically necessary product does not justify using the same purchased halo to sell an entire ecosystem of unnecessary or hazardous ones. I don't think anyone in this chain set out to harm a child. That is exactly what makes the system so durable. Every layer reinforces the others. The legal framework classifies the label as a statistical survey claim, which means no one has to prove the product is safe, only that the poll happened. The polling firms pay doctors for brand awareness data and sell it back to brands as medical authority. The brands print it on products carrying sugar, heavy metals, and microplastics, because the label suppresses the very scrutiny that would catch those hazards. The institutions that could challenge the label are funded by the companies that buy it, and the transparency law that could expose the financial relationships was written with a carve-out that exempts baby products entirely. No single actor is behaving irrationally. The data broker is selling a legal service. The pediatrician is completing a paid survey between patients. The brand is using a legally permitted marketing tool. The AAP is accepting sponsorship under a vetting process it considers rigorous. The FDA is exercising enforcement discretion within its statutory authority. The FTC evaluates the survey's methodology, not the product's chemistry. Every institution is doing exactly what it was designed to do. The outcome, a parent paying a premium for a product endorsed by a polling statistic, containing contaminants the endorsement was never designed to detect, is not a failure of the system. It is the system working as built. Understanding the system doesn't mean you're trapped by it. It means you can finally see which signals are real and which are purchased. At the systemic level, two reforms would change this landscape. The first is adopting the core principles of the WHO International Code of Marketing of Breast Milk Substitutes, the framework the European Union enforces, which would restrict medical endorsements on infant feeding products. The second is expanding the Physician Payment Sunshine Act to include manufacturers of infant formula, toddler milks, and pediatric nutritional products, forcing every payment, sample, and sponsorship into the public record. Neither reform requires new science. Both require political will. At the individual level, the single most impactful change is this: train yourself to treat the words Pediatrician Recommended exactly the way you would treat the word delicious on a bag of chips. It is a marketing claim. It tells you nothing about what is inside. Instead, look for certifications that require independent laboratory testing of the finished product. The Clean Label Project Purity Award physically tests products off retail shelves for over 400 contaminants, heavy metals, pesticide residues, plasticizers, using ISO-accredited labs. EWG Verified screens against a database of chemicals of concern and requires full formulation transparency. These certifications test chemistry. The Pediatrician Recommended label tests brand awareness. For bottles, glass or food-grade silicone eliminates microplastic exposure during heating. For baby food, prioritize brands that voluntarily submit to independent heavy metal testing and publish results. For toddler nutrition, read the sugar content on the back of the package before you read the endorsement on the front. Not every family can afford the cleanest option on the shelf. If nothing else changes, stop heating milk or formula in plastic containers. Transfer to glass before warming. This single change removes the primary pathway for microplastic exposure, and it costs nothing beyond a glass container. And when your pediatrician recommends a specific brand by name, ask one question: is there a clinical reason for this brand, or is it the one you're most familiar with? That question separates their medical expertise, which is real and valuable, from their brand recall, which is manufactured. The words Pediatrician Recommended will still be on the shelf tomorrow. They'll sit in the same clean font, in the same reassuring position, on products carrying the same sugar, the same metals, the same plastics. The system that put them there is legal, profitable, and self-reinforcing. But you see it now. And a parent who understands how the label got there is a parent who reads past it. What product in your home right now carries that label? Check the ingredient list on the back and tell me what you find.